We've got 20 minutes and there's an opportunity for you to ask questions or invite comments from the speakers. It's hard to see from here, so you'll have to wave vigorously.
There's one in the front here. Dave.
Yeah.
Thank you. Yeah, David Harley from Brisbane. I wanted to direct a question to both Nick and Maxine. I'm a bit interested in vector-borne diseases, and I mean, in some ways they're simpler than some other things. They're simpler than sort of social change and war and migration and things, but they're actually not all that simple. We are probably getting better at counting when it comes to vector-borne diseases. And perhaps Maxine pointed to some of that. But if we agree that it's hard to count when it comes to both the exposure and the outcome with climate change and vector-borne diseases, what are our strategies going to be between Maxine and Nick for becoming better at communicating about them? Because I think the messages that sell newspapers are that we're going to have dengue in Melbourne next year, and I think we all in this room know that it's a bit more complicated than that. So what are we going to tell the newspapers?
That's a good question. I spend far too much of my time talking with journalists about climate change and human health. And probably the thing that I come back to again and again and again is climate change is bad for your health. Yes, there are complexities, and we have some of the smartest minds in the world working on those complexities. But when they add everything up and they all look at it, the conclusion they come to is that climate change is bad. I think sometimes in public health communications we trip ourselves up a little bit because we know so much about the topic, and we're fighting against a group of people that really don't care that much about the science. I think we need to become better communicators. We need to put a human face on it. We need to take some real examples where we have seen either climate change or climate extremes sort of impact human health. We need to tell those case stories. We need to look at examples like Zika virus and say, look, we don't know much about the impact of climate change on Zika virus. We know a lot about the impact of climate change on Aedes aegypti. But what we do know is that that's an example of what happens when a global healthcare system or a country's healthcare system is taken unaware. And we expect much more of this in the future. I keep things simple rather than trip ourselves up.
Yeah, I mean, I definitely wouldn't provide the amount of detail which I only briefly summarised today around all those complexities in talking to the general public or journalists. It was the audience that's here today. You know, the rule I was always taught is don't have too much hyperbole when you're trying to work as an advocate, that you need to have really good data to back you. And so I think the cumulative data shows exactly what Nick was saying, that climate change is going to make some places have more vector-borne diseases, some places have maybe less, but the cumulative amount of, the cumulative impact upon often very weak health systems that are weakened by other aspects of climate change is going to be bad for global health and going to be bad for our health. The ability, particularly of health systems, to be able to respond, well, predict and respond is what I think we need to focus on rather than what the impact is going to be. We've got to actually be involved in prevention, early warning systems, and a health system that can respond to reduce the deaths and disability that can occur from vector-borne diseases.
Colin, I'd quite like to hear your thoughts on this. I mean, you must spend a lot of time talking to the press. What's your advice in terms of the best way of presenting a complicated and important issue like this?
Well, I tend to agree with Nick, actually. I mean, it's about making relevant or making simple the messages, and you have to kind of cut it up depending on who you're talking to. Journalists aren't particularly interested in detail, and the attribution of, say, dengue to climate change, the exact attributable piece is irrelevant. I mean, for the most part, provided, of course, there is the association is strong, you can simply make the connection between the two phenomenon. I think we tend to overcomplicate things, and broadly speaking, if you're talking to the minister, for example, keep it simple. Some ministers like facts and evidence. Some ministers don't, because it challenges their own ideological beliefs and their promises to the voting people. So, I guess it's an old thing about knowing your audience and cutting your message accordingly.
Yeah.
Celia, do you got any observations on this?
Yeah, I agree with what everyone's saying. I think there's always a bit of an anxiety with talking to journalists, because you feel like you need to put so many caveats in case it gets misrepresented. So classically, if I speak to a journalist, I'll end up with a title saying something about climate refugees, which is very problematic. But so I guess the thing is to keep your message simple. Be willing to be perhaps misrepresented a bit, so long as your core message is strong and consistent and matters.
I think as long as you have the directionality of your message, as long as the directionality of the message is faithfully reported, and as long as the order of magnitude that you're talking about is faithfully reported, then you've done a pretty great job.
Right, who else have we got here? Lynn.
Oh, thank you very much indeed, Alistair, and thank you everybody for a fantastic session. So Lynn Madden, I'm the President of the Australasian Faculty of Public Health Medicine. This is an urgent issue, and we need to take action very swiftly in the next few years if we're actually going to make a real difference in the long run. And Colin, we're here at the College of Physicians meeting. Essentially, what do you think that doctors can do and do immediately to make a difference to this issue for you?
Well, I thought the first session in the morning had some very useful ways of thinking about this. Doctors are influential, but as he pointed out, you've got to hunt in packs. I mean, a group of professional physicians saying something backed up by good science is hard to refute, even by politicians who don't believe in climate change, for example, or journalists who are skeptic. I think the leadership, the influence of professional associations. I don't know if you notice in my slides that I think citizens groups, professional associations, interested, enlightened private sector folk are going to continue the momentum on climate change, even if some governments are going to kind of stall or pull back. So, and provided there's a strong advocacy from political leaders, I think the combination will continue. I think there's some squabbling over detail, to be honest, in a sense, and provided that momentum that I referred to earlier is maintained, yes, of course, it's going to be difficult to get to the 1.5 that everyone in the Pacific is hoping for, but something close to 2 degrees is still better than 4 degrees. I can't remember the actual projections that Alistair had on his slide, so I guess I'm optimistic. I think that it's unfortunate that one influential player changes the whole dynamics of what is a landmark agreement between nations. I refer to the Paris Agreement. Sorry to go on.
I suppose just the point to make, it's a technical point, but it's important nevertheless, is that the United States can't pull out until about the date of the next presidential election. So they're bound to the Paris Agreement, whatever the president incumbent says he would like to do. So we wait with interest. Did anybody else on the panel want to answer the question about what can doctors do in particular and what should their priorities be?
I mean, I'm particularly interested in the global health and the aid budgets. We've just had the budget come out with a cap on development assistance. But what folk in DFAT have often said to me is, Maxine, the medical professions need to actually come as advocate groups and meet with the minister and come through DFAT, that you don't do that enough, that often we might complain about how some small items seem to take an inordinate part of the attention of the DFAT budget. But that's because those people do go and advocate and knock on the doors and have those relationships. Whereas often we as a profession don't do that, or feel shy, embarrassed, or feel the facts will speak for themselves. But we've actually got to be more active in being advocates, hunt impacts, be supportive of each other, and have more combined discussions about this with our foreign minister as well.
I'd maybe look a little further abroad as well. Look at what health professionals in other countries have managed to do, and it's really quite heartening and quite impressive. The Canadian Medical Association has divested all of its funds from fossil fuels because, just like alcohol and just like tobacco, doctors shouldn't be investing their funds in something that directly harms their patients' health. The UK Health Alliance on Climate Change, which brings together all of the Royal Medical and Nursing colleges in the United Kingdom, spent a very long time, spent 2 years lobbying the government to phase out coal, and towards the end of last year got an absolute commitment, public commitment from the British government that it would no longer use coal as a source of energy by 2023, not because of the climate change impacts alone, but because of the health impacts that coal had as well. There are some really impressive things that health professionals are doing all around the world. RACP, shouldn't be left out there as well. Its commitments to divestment, the work that it's done has been impressive. And the one that I think we skipped over very briefly this morning, David mentioned in a slide, and he was very humble, so he skipped over it. The NHS has decreased its total emissions by 11%. That is enormous. That's something that's unprecedented. And it's done so whilst saving money. It's done so whilst improving public opinion, public perception of the service and of the actions that they've done there. It's done so whilst activity has gone up. There are all sorts of things that health professionals can do and are doing around the world.
I'm Ian Webster.
Yes.
Over here. I'm Ian Webster. I'm a physician, and I've been involved in community health and national mental health policy in Australia. And I was struck by Colin's presentation, where he spoke about the impact on the sense of well-being and the mental health impact of disasters, but I imagine the uncertainty in the environment would affect the mental health in your populations. And I wonder to what extent you deal with this, or how you deal with this. I'm aware that the data on suicide statistics, for example, are not good in some of the Pacific countries. So it's a question, what is the impact on the sense of well-being, but also particularly the impact of these disastrous events that take place on mental health, and how you respond to that?
Well, thanks very much. Firstly, mental health and mental health services in the Pacific is a poor cousin of health services, full stop. And so we're starting from a very low base. The specifics to do with change and uncertainty and climate change and relocation is what I was doing, essentially looking to recruit smart masters of public health or related. If you're looking for a career, here's a wide open field, because there's much that we want to know that we don't know. The third comment I'd make is that there's a small political grouping called the Melanesian Spearhead Group. And a couple of years back, they did some work on traditional notions of health and well-being. Nothing to do with the kinds of things that you and I might be familiar with. They talked to a bunch of people in Papua New Guinea, Solomons and Vanuatu mainly, to ask them to characterize what they think is important. Interesting set of findings, one of which is that the circumstances that Vanuatu folk find themselves in sometimes is they regard it as not quite their lot, but it is to be expected. And so you see Vanuatu often coming up as one of the happier places on the planet. What I'm saying is that we have our own notions of health and well-being, but it's important to stop and reflect that for traditional communities, they will have their own notions of health and well-being. Having said all that, one of the slides I didn't get to speak about is some graves that were broken down from one of the islands up north. And this, in fact, has been one of the major impediments for people moving. So they can see the wisdom of moving for safety, but they keep asking our teams who work with them, what are we going to do with the ancestors that are buried, even though the water is encroaching very closely to, so the dead or the families who are buried in their village is a major issue for them in terms of thinking about their own sense of who they are and their health and well-being. It's a bit of a ramble, but you can see the complexities of all of this in the sense that we might have our ways of trying to measure health and well-being, but they will have their own as well. And what might be important to them isn't necessarily what's important to us. And that makes the business of relocating communities and supporting them to move for safety reasons a lot more challenging.
Yeah, I thought that was really well put, Colin. It wasn't a ramble at all. Do any of the other people on the panel want to respond to that comment about mental well-being and mental health?
No, I think I need to add, it's vexed in that, you know, there are mental health impacts for sure. I mean, I agree with you, Colin, there's issues of being displaced from places you feel like you belong and, you know, disrupted social structures. But at the same time, you'll remember Colin showed that picture saying we're not drowning, we're fighting. Was that the words? And so I think there's also that spirit of we want a viable, hopeful, alternative future. And the way to achieve that is by mitigating greenhouse gas emissions. We're not kind of vulnerable and giving up and despairing. That we want to head in a more positive direction. So yeah, it's that two thing. You need to recognise those mental health impacts, but also not position people as just giving up and despairing.
Look, we're approaching 3 o'clock. I have one question I'd like to ask from the chair by way, I hope, of drawing this all together. And that is the capacity issue. And I'd be interested if each of the members of the panel would just reflect on this. What is it that we can do individually and collectively as a medical profession in Australia and New Zealand to best help people in the Pacific to themselves take on the challenge of understanding, managing and responding to the problems of climate change? Starting with you, Colin.
I guess to repeat what I said before, I think the college and the associated associations have enormous influence on these things, and what you say matters. And if you say, look, the Pacific, the issues are such and so on, some folk would listen. Secondly, I think those of you, instead of going off skiing in Whistler or doing what you do, you could consider coming out and giving us a hand. We have a funding agreement with DFAT to do certain things, but I actually like to have people with experience that we can deploy to Vanuatu and Tuvalu and places to help people help themselves. That's a much more engaging and meaningful existence. Money is important, of course. Don't report me to DFAT. But what I'm saying is that you have quite a lot of capacity within Australia to help to power up some of our very limited and small nations. They're very practical things that you can do as an individual or amongst your friends and networks and friends, and certainly in your professional capacity. I think you could try to influence your own political leadership about stepping up on the resources that go to climate change in our region, and perhaps a bit more appropriate leadership. That's why we've lined up with Macron. I think he's taken on a very strong leadership role on this issue, and that's why the Pacific leaders have warmed to him. New Zealand, I'm pleased to say, is coming on stream, but you know, we're still a little bit wobbly, I say, and we need to do better.
Thank you. Anybody else like to respond to that question?
Well, I suppose I tried to in
Yes,
that last slide.
I understand that.
And I do think particularly many of us in the room are educators. And so trying to I think the important thing is partnerships, taking up with what Colin was saying, that if we do go as partners to work in this, not to necessarily take our models of from Australia about how to do these things. I mean, sitting, listening to how we're trying to make sustainable health systems ourselves, you know, go and listen and work with people in the countries to find solutions that are appropriate there, particularly at a preventive and primary care level.
I think I'd say the single most important intervention on climate change, if you want to simplify it, is the Paris Agreement. It's by far the best shot we've got at getting anywhere near the sort of levels of, you know, temperature levels of emissions that we're looking for by the end of the century. It's under threat, and at the moment, Australia isn't threatening it directly, but it's certainly not helping. And part of the reason for that is we, as a public, think of climate change as something that's far too far away. It's not our problem. It's not this generation's problem. It's probably not Australia's problem. And we have the capacity to punch well above our weight in the international community and back up some of the small island states in the Pacific that we're starting to see. In order to do that, I think the one key thing that we really, really need to change is we need to stop understanding climate change as an environmental issue. We need to fundamentally reframe the argument and understand that climate change is a public health issue, it's a medical issue. And who better to help us do that than physicians?
Celia, any last comments?
I think I'm just going to be reiterating the same points. Yeah, keep the temperature increase to 1.5 degrees at the most. That's the best thing that can be done.
Well, look, thank you very much. We've been privileged to hear from 4 people who know this area very well, who come from a variety of different angles, and yet obviously have some important similarities in terms of their prescriptions, diagnoses and prescriptions for the problem that's in front of us. Could you please join with me in thanking our speakers?